Justice for all. Okay. All right, well, thank you for that. And I don't see any pictures. Is everybody online that needs to be online? There we go.
Hi.
Awesome. Okay. Well, I'm going to apologize up front. We are all going to eat in front of you, so I'm sorry for that. But the meeting is all yours.
You can't virtually share?
We can try.
Oh.
You want to push that towards you?
I was just going to turn the volume up. I don't know how to do that. Oh, no, that's all.
We can talk louder if we need to.
Yeah,
It's really quiet.
you're gonna have to probably,
It's on, isn't it? I think it's on this.
Tyler, what are we looking at?
What was that? I'm sorry.
We need to turn up the volume. Which one is it? Oh, here, got it. Got it. Got it.
What was that? I'm sorry.
We need to turn up the volume. Which one is it? Oh, here, got it. Got it. Got it.
Okay.
All right.
That work?
Sorry about that.
Does
I
that
was
work?
That's work.
Oh.
Okay.
Well, this is Angie, and we sent Tyler a few slides that we figured we could start off with, but thought we could start off with introductions first, and then tell a little bit about us and how we evolved into who we are as the IPAC and how we work. So, and then we'll dive right into our site visits with your schools. Does that sound okay?
Excellent.
Sounds great.
So I will start. My name is Laura Ebinger. I'm an infection preventionist. My background is in public health and epidemiology. I've been an infection preventionist for 10 years, board certified in infection prevention, and co-founder of IPAC.
Very good.
I can go next. I'm Preeti Kondal. I'm an infectious disease physician, currently practicing, but met these wonderful ladies and thought we would develop our company together to do what our passion is, and share that with everybody else. So glad to be here.
Awesome. And I'm Angie Dixon, and I'm like Laura, I'm an infection preventionist, board certified, and I'm also an APIC fellow, which just is fancy words for saying I've done this for a really long time. So I'm a little old. And so, but I'm a nurse by background, and I went into infection prevention, and then my passion is community health. So I have my master's degree in community health. So really, that's what's the beauty of me, working with Laura and Preeti, and us putting together our business. So Tyler, if you want to hit the next slide, we're just going to give you guys a little bit of preview about a little bit more about who IPAC is. And but we are a woman-owned business with shared expertise and a dream. And our dream is to really share our passion, which is infection prevention. Most of our experience is in the hospital setting and outpatient setting, but really we see it bigger than that. So the three of us got together and we created what we called our napkin plan back in 2018, and we executed in 2019. We became incorporated, and we really have a non-traditional creative approach that is really focused on meeting people and teams in the community where they're at the riverbank, and really trying to help problem solve together. And so next slide, Tyler, I wanted to share a little bit about infection prevention, because that's kind of a big, long couple of words. And anytime somebody thinks about infection prevention, they also think infection control, which control is a piece of it. But control means it's kind of like the three levels of primary, secondary, and tertiary, prevention, right? Control is about controlling the bug in the moment. And we feel our emphasis is really on prevention, so a little bit more upstream. And so that's just kind of, we look at all sorts of slices of the pie, although this isn't really a pie, but there's a lot of components that we look at. And from the bug that we're working with or thinking about to, what's going on in the environment, that could be traffic patterns or what have you, the built environment. So the HVAC system, other bugs that can be lurking in the environment, like mold and waterborne pathogens. And we really, obviously, the foundation is science and the most current evidence-based practice. And then infusing other things in there like training and data and technology and all of those types of things. So next slide, Tyler. This kind of describes our background when you think about, the community health sectors. And, we really see our vision was really, hey, what if we could share our expertise across the community health sectors? And so really that's where we started, kind of thinking bigger than just the hospital setting. In 2001, so quite a little while back, Jarvis published in an emerging infectious disease the need to really expand infection prevention across community health sectors. And 2001 was a long time ago, and we really haven't gotten quite as far as we need to. So we really wanted to fill that gap within the, whether that's nonprofit, the school systems, whatever it may be. So we've worked with several nonprofit, faith-based, as well as businesses, and then more recently with the schools in terms of COVID-19 pandemic. So next slide, Tyler, is really kind of describes our theoretical model, and hopefully we displayed this with Creston and her team while we were on site there. It's really using a model based off of Meredith Minkler and Barb Israel around a community-based participatory approach for working together, where we infuse our expertise, which is based off of some key core competencies, Infectious Disease Society of America practice guidelines, obviously CDC and World Health Organization, but infuse that with your expertise in the school system and what you do day in and day out there for our students and our kids in the community, and as obviously board leaders as well. And so how can we cross those boundaries, so to speak, and really develop something that really works for you guys, especially right now, given the pandemic? That's obviously our main focus, knowing that we're definitely better together. And so go ahead and hit the next slide, Tyler. This really kind of describes our business or our working framework. And we kind of developed our own model, if you will, based off of some lean principles and healthcare quality, but we call it a pie. So essentially there's pieces of the pie, right? A stands for assessment, P planning, I implementation, and E evaluation. And so we use that holistic model and to help support whatever it is that you guys need along the way. And so, for example, really, working with the schools, I had it tallied earlier today, I can't remember, but 30 some schools that we've been in building wise. And really each school is very different. Even your schools that they're in Eatonville, each one is different. It has its own unique culture. So how do we work together to create a plan and a process that works the best for you, and then help provide and support your written plans, your tools, your education, data analysis, and ongoing consultation. So while we're here tonight, we're with you guys through next year, whatever it takes. And so we're partners with you. We're not going to drop a bomb and leave, so to speak. So we really value your partnership through this and want to support you however we can. And so that first step really was just doing those initial site visits. And if you could go to the next slide, Tyler, one thing that we got to talking about on the site visits is really around the Swiss cheese model for pandemic viruses, respiratory viruses in particular. And this particular model keeps coming up. It's been reiterated one time since then with more factors, but this one I think speaks volumes really in terms of what we're trying to do with the COVID-19 pandemic plan for schools. Is really trying to hit every single one of these Swiss cheese variables. And it's not one thing. There is no silver bullet. It's all of them together making a difference to ensure the safest possible environment for our kids and our staff as well. And I know that's one thing that we saw very apparent in every single one of the Eatonville schools was that safety was of utmost priority for students and staff. So yeah, so you can kind of see how each element here, and I think this is a good visual for the plan that you guys have in place, and then the few things that we talked about and processed with you guys while we were there. And that physical distancing, the HVAC system, and how do we manage that in the various different buildings and make sure we have the right filters, and if we can't use the higher filters, then how do we skin that cat? Obviously masks is a big one there, and you could extend that to additional PPE given the risk of the particular situation that might warrant additional PPE. Of course, hand hygiene, social or surface cleaning and disinfection, that's super key. You can have a clean environment, but that doesn't mean that it's disinfected. So it's kind of that combination effect. And then fast and sensitive testing and obviously tracing, but you guys are forerunners really in our experience so far with partnering with your local health jurisdiction to do a testing pilot. And so that's just phenomenal. And then of course, any sort of tracing, quarantine and isolation, on ongoing messaging. I think probably that's one of the bigger challenges is there's so much information out there. So then how do you synthesize and translate that into practice? And then financial support, and of course vaccines, which we are starting that journey. So that's kind of exciting. So that's kind of, the other viewpoint of how we've kind of worked with the schools when it comes to, their COVID-19 planning. In terms of Eatonville, if you want to go to the next slide, Tyler, we kind of put some high level points together that we wanted to share with you in terms of just all of the best practices. Honestly, this is not a comprehensive list, but they were key ones that I felt we wanted to make sure we processed and shared with you guys. First and foremost, the boots on the ground, what we call in the healthcare setting, the sharp end people, the ones doing the work. John and Heidi are phenomenal here. John is, he's just so practical and on it, and was super far ahead in all of his work. Funny story on one of our first schools that we were in, when we always like to go into the janitor closet, right? That's like all of the cool stuff's in there from us infection prevention nerds. And so we saw our most prized possession product there in terms of what we feel is one of the best products on the market for environmental cleaning and disinfection. So that's the kind of level that John has brought to your guys' schools, is the best of the best. He had portable HVAC systems ready to go. They had just arrived when we were there, and we validated those, and literally, again, first class all the way. And Heidi, your school nurse lead, she's just phenomenal. She's all on it. She's great plans in place, no doubt about it. So some great expertise there. And then from there, really, everything was organized, very visibly clean, no doubt about it. And again, that student and staff safety as the #1 goal was very apparent everywhere we were at. Everybody was working together, very focused on the science and evidence-based approach, yet trying to keep that unique, bigger picture perspective in place, in mind in terms of the school. Definitely above and beyond with the PPE. I think that's a testament to Heidi's work. Not very many schools have the ability to fit test, and Heidi had it for N95 respirators, and Heidi has that skill set. So that was just mind blowing. Lots of excellent written plans and procedures. We've looked at many. Heidi shared a couple of more. I think it was earlier today. We haven't looked at those yet. But we're gonna, we told her we'd definitely look at whatever she wants to throw our way. We shared our skeleton plan and respiratory protection plan, and she's taking those and running with those, and we call it steal shamelessly, whatever she needs from us, totally whatever. All the schools are cohorting in the classrooms. And especially in the smaller elementary schools for meals and recesses. So that's super important, is keeping those classroom cohorts together to minimize any other potential exposure and then subsequent trickle effect from that if there were a positive case. Cleaning and disinfection procedures were great. They're definitely incorporating alternative technology. I think it was the high school, they were looking at kind of these lanyards that would help track potential social distancing and that type of thing, which was kind of cool. And then I think we mentioned the testing and collaboration going on with Pierce County. So again, another hole in that Swiss cheese model being plugged with that comprehensive approach. Next slide. Some of the things that we talked about on our walkthroughs and focus areas is just maybe some fine tuning of bathroom procedures, and that's just simple as focusing on social distancing and maybe limiting the number of kids in a bathroom at a time, and kind of blocking every other stall and that type of thing. Sometimes just something as simple as blocking a stall kind of forces people to do what they need to do. So until things kind of become muscle memory, having those visual indicators really helps make it easy to do the right thing, and keeps us from kind of going back into our normal mode of congregating, and especially in places like bathrooms. Some vending machines, which allow for congregate area. So we want to be processing that with you all, as we continue to, we'll be coming back, I think, in January to do some workout sessions on some higher risk things. We could potentially tackle vending machines there. But that's fairly easy in terms of, just putting alcohol-based hand rub signage and social distancing circles, and just kind of, again, those visual cues. We're working with John on just tweaking a couple of products, nothing crazy there. But again, he already has all of the key products. Sometimes what we're seeing right now is access to those key products can be difficult. So then how do we come up with a backup plan so that you don't end up without product and that type of thing. Limiting water fountains, we've been talking about that. Definitely, he was already on this one, which is adding the portable, what we call H13 air purifiers, and using kind of a risk-adjusted model for that. So we talked about that on our walkthroughs. Staff rooms and break rooms. What we're seeing in hospital setting is this is the risky area. This is where our caregivers are getting sick, is the break rooms. It's not from patients for the most part. So, we're just translating that into the school areas as well, because that is one of the most riskiest areas, because people don't have their masks on. You tend to be more comfortable with your colleagues, so you're less apt to social distance, and then you're laughing and you're cutting up and you're eating, and just all those aerosols or droplets start spewing from there. And then we're continuing to have discussion around PPE and safe donning procedures, or doffing. Donning is putting PPE on, and doffing is taking PPE off. I always say donning isn't the problem. Just get it on and wear it, right? But taking it off is where it can get people into trouble from a cross-contamination perspective. So again, supporting Heidi with whatever she needs on that. And we're willing to help support however as well. And then kind of solidify the place and processes for the isolation room in each one of the school buildings. We talked about a lot of different areas and how to do that. So just really kind of hardwiring that before you guys do open. And so those were kind of the key focus areas. If you want to go ahead and hit the next slide. I thought we would just kind of process and throw out there before we open it up, kind of what we talked, Preston and the team and Dr. Condell and I talked about while we were there, is our next steps. Is helping support the written plans. We shared all of our templates, and I know that work is ongoing. We have some trainings that we're providing. I think we sent those links out, but the state guidelines, and I recommend that all businesses and schools, any sort of entities like this, have what's called a COVID-19 supervisor on site at all times. And so we put together a COVID-19 supervisor training that has a quiz at the end and a certificate of completion. And we've been recommending that all school buildings have at least 3 quote unquote COVID-19 supervisors. That way you have some sort of backup plan to the backup plan, and always have somebody readily available with that extra content. And then cleaning and disinfection 101, we learned, especially with our Lewis County schools, is everybody's doing cleaning and disinfection right now, right? And so it's not just about the janitors anymore, but there's a lot of nuances to cleaning and disinfection to be able to do it right and do it reliably. And so that's what this training tackles, is that, and it's a similar format. It's an online module with a quiz and subsequent certificate of completion. We've reviewed all of your products to date, and we have an ongoing, what we call live living document of products, IPAC approved products. And so we have your products there. And anytime you guys need extra hands to evaluate a product, we're totally willing to take that on for you guys and ease your way on that. We are going to be coming back in January to work with some groups on some high risk things. It's not a comprehensive list on the slide, but we talked about several things that we want to process out loud together. The OSPI and the Department of Health, they're pretty specific. They make a broad statement for everybody, but that doesn't always make sense literally for everybody. So, we've been having conversations with schools about how we can do some of these things safely. And so that'll be kind of what that workout session will be for you guys in your schools. And then ongoing consultation. I think I mentioned earlier, we're not going away. You guys are stuck with us. I'm just kind of teasing, but we really will, emails, phone calls. If you guys need some help to sort something out, we're definitely here to support you guys. And so, yeah, that's pretty much our summary. Preeti, I don't know if I missed anything or what you want to add, since you were there on the site visits as well.
No, I think you did a very good job. I think that in all this chaos, I think everybody has done a great job, and what I appreciate, and that's kind of why we're all here, I think, is we all want to get the kids back in school. And, you know, with us being in healthcare, I know what the risk factors are. And I've seen firsthand what it can do, but yet I think there's ways that things can be mitigated where we can get kids back in school. And the reason I feel so strongly about it is, and I'm going to give a personal example, is my son has been going to an in-person school since September. And I don't think he would flourish where he is. And granted, it's kindergarten, but I think just with that, if it was done at home, and I see that, and I feel that this should be provided to all the kids. So I mean, that's partly the reason why we're all here. So, but I appreciate everybody's efforts, and I think everybody's done a great job trying to make sure that that happens. And if we can help in any way, and whatever we can do, again, it's all about, we're all taking risks by doing this, but understanding how we can make that risk be as small as possible and be as safe as possible for everybody. That's our whole goal.
So yeah, and I think it's good. It might be fair to even say too, our first school, we started working, what was that, Laura, back in early summer?
It was in the, summertime.
And they opened at normal time, fall time, and they've been open ever since. And then Lewis County followed suit. And while several schools, including our first school, have had positive COVID cases, and you guys will too if you haven't already, but because the plans have been so solid and well thought out, and there's an exposure control plan, which we heard very clearly and saw it in your schools, following those things. None of the schools that at least our initial school and the Lewis County schools to date, have seen transmission inside of their buildings, because they've been able to, decrease the risk as much as possible, follow their exposure control plan when they do have that positive case. But to date, to our knowledge, nothing's been tracked back to the school setting. It's been community setting. And so, I think that's a testament to all of the hard work that the schools are doing to ensure a safe environment for everyone. So, yeah.
Any questions?
Yeah. Comments, thoughts?
Well, can I start?
Yeah, go ahead.
So, can you hear me? Can you hear? Okay.
Yeah.
Yes.
I just want to thank the IPA group for coming out. You were so thorough. It was a joy. Really, you came on the nicest day. The mountain was out. It was beautiful. It's always
It was
like
beautiful.
that. It's always like that. Not today. But I have to say that, your level of detail was amazing. And I just, throughout the day, I know you kept hearing me say, I'm so glad you're here. I'm so glad you're here, because we had been questioning, is what we're doing correct? And you were able to say, absolutely, it is a correct, and this is how you can make it better, or this is what we suggest. And so we really look forward to partnering with you. I met with our teacher union earlier today, and they are very excited. You're coming back on the 6th, and you will be starting, I believe, with our special education teachers. And then we'll go to the band and PE, and we'll send you that information. But I know that they will have a lot of questions that we will send you, so that you will be able to, at least have a feel for what people are wondering. And I just, we feel so fortunate in Pierce County to be able to have a partnership with you, because we have that Lewis County connection. So I feel like we have won the lottery.
Yeah.
Yes. Okay, now.
Anybody have any questions?
So I guess I know you can't honestly answer this question, but I know we're going back into hybrid and we've got vaccines coming. In your professional opinion, will we be back into every student in school every day next fall? Is that remotely a possibility?
I'm gonna say not yet.
Oh,
Part of it
yeah.
is probably would have to do with everybody. I mean, to get herd immunity, you need a large proportion of the population either vaccinated or have had the infection, knowing that it's not going to come back. And I don't think we're going to achieve that by next fall.
Mhm.
So
I
we
would
need
love to, but I don't think we would be there.
to prepare for another year of hybrid.
I
Well,
think so.
Yeah,
So-
I
so-
agree.
Can I ask that question though, Doctor?
Sure.
Because- So today, I don't know if you're aware, but the governor changed some information, so the decision-making tree looks a little bit different.
I
It's-
heard it was coming, but I have not looked. I don't know what the change is. I knew that there was discussion about that. Yeah.
So they as part of that, they allow us to have 15 students as a small group. And so, you know, our hybrid, I mean, we have many of our classes that are really close to 15 total. And so, you know, I think that might be a question as we go forward. If we have a class of 9, is there any reason why it would have to be a hybrid? You know, every other day, I don't know. So those are questions that they're too new right now for us to understand, but I believe by January 6th, you know, I might have more questions like that.
Sure.
Yeah, absolutely.
And it'll give us time to process it too.
Yeah.
Exactly.
Right on. Any other questions? Okay, well, I was very happy to meet you folks at the middle school. Was really impressed by your thoroughness, and you're certainly subject matter experts. So it was really gratifying to hear that you folks agree that we seem to be doing a really good job here. And I know everybody here is really excited to tweak a few things and make it even better. So we're really happy to have you helping us get this up and running. Feel really good about what we're doing, and we got a little room to grow, and we'll make it happen. So thank you very much. And if nobody's got anything else, I wish you happy holidays, and we'll let you go.
Likewise.
Likewise.
All right, thank you.
Thank you.
Guys.
Thank you.
Bye. Thank you.
Bye.
Bye.
Okay, Tyler, can you turn us off?
Yes.
Awesome. Do I need to turn this